In charge of this. She's asked me to come and talk today, so I still turn towards her to give me direction. My name is Laura. My last name is Kruyf. I come from Sioux Center, and I'm the mental health nurse practitioner that's here. Some of you may remember Tasha. I know she's done lunch and learns before. I was her student, and when she decided to move on, they asked me to come on board. So I've been here since November, and I love it. This is a career change for me, I will be honest. I've been a nurse for almost 30 years, but I did not do it all in mental health. In fact, this is the first mental health job I have had. I did a lot of different things in nursing, most adult nursing things except for OB and OR. But when I moved to Northwest Iowa, to Sioux Center 14 years ago, I had most recently been working in the ER in LA, and I decided I wasn't going to find that in Sioux Center. So I decided to shift my career at that point, and I started teaching nursing at NCC. And so I taught in their RN program for 8 years, 1 year as a clinical instructor, 7 years in the classroom. So this I'm good with, for the most part. Making a PowerPoint and standing in front of people, I feel like I can handle that pretty well. When I started teaching there, they assigned me the mental health units, the most uncomfortable units I taught at first, because I didn't feel like I understood them. I didn't know them. I didn't have the true understanding for mental health like I felt I needed to. So I kind of dove in head first. I visited with people at Cherokee, if you've heard of Cherokee Mental Health Institute. I started to learn a lot more, and then I realized, my goodness, I've actually been dealing with mental health my whole life. If it wasn't me, it was my family, it was my friends, it was my husband, it was my kids. And so then I started realizing this whole mental health thing is not scary. And so I decided to go back to school again, and that's what brought me here. So now I have these initials behind my name that stand for Psychiatric Mental Health Nurse Practitioner. In case you're still curious, because a lot of people are, what that means I can do, what I do here at our clinic is I can prescribe meds, and I can also do therapy, and I can do both. So some people come to me for one, the other, or both. And that's the great thing about our clinic here, is that it does allow that psychotherapy aspect, because there's not a lot of therapists here in Sibley or in the surrounding areas. So I get to do a little bit of all of it, and I love it, and I feel very honored to be here. So today, I wanted to share some things about our childhood and how that can impact us in childhood, but also impact us in adulthood. So this is not a child talk, this is a everybody talk that we can all learn about and learn from. So the fancy wordage we use is adverse childhood experiences. Then we shorten that to ACEs, just because that's a lot easier for me to say. So there's been some research done in the last 10, 20 years that has told us more and more about ACEs and their impact. So these adverse, meaning bad, childhood experiences that we go through. Now, some of us are of the generation and of the mindset and of the society that believes, oh, just pick yourself up by your bootstraps, brush it off, you're fine, don't worry about it. We're learning that's actually not true, and that's what we're going to talk about today. So I'm hoping that today's talk is just going to help us understand these experiences, how they can affect us, even long term, even into our adulthood, and how they can actually impact your life. It can kind of also help us know what we could have done differently, how we can help, and how to move forward. This is not a talk about, well, you've had trauma in your past, so that's what we can just sit in and you're never going to get better. There's hope, even for us as older adults, younger adults, children. So what are ACEs? They are, again, adverse childhood experiences. They are potentially traumatic events that occur during childhood, so ages birth through 17. That's where we get the name from. It doesn't seem too complex or difficult to understand at that point. But what are they? And this is where the science and the research has broken it down into different categories. And so we have the household challenges, the abuse, and the neglect that can come in. So when we are looking at this, we are looking at things that are happening within the home. So when we're talking about domestic violence, and we look, and I got my little references down here, the American Psychiatric Association Foundation has described these as, for example, domestic violence. A family member is being pushed, grabbed, slapped, kicked, with a fist or threatened with a gun or a knife. That would be what they're considered domestic violence. So as a child, if you're living in a home where this is happening, that would be considered an ACE, an adverse childhood experience. Substance use, that feels fairly self-explanatory. It doesn't mean the child had substance abuse or substance use. It means a member of the household that they were living in was using substances and misusing substances. Mental illness, again, a person in that home that the child grew up in was struggling from something maybe like depression, or maybe they had attempted suicide, those types of things that they're referencing. Parental separation or divorce is another one. The child has lost a biological parent through divorce, abandonment, maybe another reason. That is considered what we would call an ACE, a trauma in that childhood. Incarceration, a member of the household has gone to prison. That too is considered a ACE. Then we move to the things that feel a little more like, that makes more sense, right? Then we move to the things that are abuse, so emotional, physical, and sexual abuse. Again, remembering if emotional abuse can be that like the child themselves is getting sworn at. They're being told negative things about themselves. You're worthless. Those types of comments that are being thrown at that child frequently. They're being put down, they're being humiliated. That's that emotional abuse. Physical abuse, I do think we understand what that is, grabbing, pushing, slapping, hitting, whatever that might be to the child. So instead of, here we're saying the household, now we're doing more, the child is the victim here in these other aspects of ACEs. Emotional neglect, they're being ignored. They may, we can have some of that as well. Physical neglect, physically aren't getting their needs met. They don't have food, they don't have shelter, whatever that might be. So then the question then says, well, what does this do to us as a child when we're being impacted, when we are being raised? What is this going to do to us? And that's where we want to move forward. I do want to pause for a brief moment and say that you do have, if you're in the room, you do have a adverse childhood experience questionnaire for adults in front of you. This would be something, as an adult, 18 or older, you come in and we may be looking at some of these negative impacts that you may have had in your life, some of the traumas that you may have had in your life. And so you may see this come up, you may fill this out, you may look at it, and then we gotta say, well, what does this mean? What are these results gonna be? The higher number, I don't have it up here, but the higher number you have of instances, so there's 10 categories in front of you. If you say yes, that's a point. Every point you get, the higher number you get, the more likelihood you have of negative outcomes in your life. So they can stack. So even if it's just one outcome, usually we can do okay. But the more we get, once we hit 3, 4, 5, we really get into that territory that we do see the negative impacts, and science shows us. And I'll get to more of the sciencey stuff in case you're interested, in case that's something that you do enjoy. So you do see that in front of you. If that's something you're interested in, you can kind of look at that and just kind of start to evaluate and maybe self-reflect even in your own self, or you can use it to maybe help evaluate some people in your life and maybe some hard impacts that they may have had in their lives. So, thinking about that scoring, prevalence. When we look at the statistics and the research, we do see that 3 out of 4 high school students and over 60% of American adults have experienced at least one ACE. That means there's been a negative impact, a trauma, something in their childhood, at least one. Almost 1/4 of American adults report 4 or more ACEs. Now we're remembering, and we're going to get into the science of this and how the brain works in just a minute, but that means 4 out of those 10 you've got a point on. We're realizing we have 1/4. So if we start looking around the room, that's 1 every 4, if we count it off, would hit this category statistically, right? And what do we know? The more ACEs, the more negative outcomes we have in our future, okay? And most common among females, to think about that, as well as American Indian or Alaskan Native multicultural youth. So we do see it a lot in our youth, especially as we have more of our, quote, melting pot here in America. We have more multicultural youth. And then the LGBTQIA plus community as well. And if you're not familiar with what that means, those would be sexual minorities, so homosexual, bisexual, etc. So yeah, we see a lot of this happening, and more is happening in our society. And again, the more numbers we see on our results there, the impacts are going to be greater. So then that brings me to, what are you talking about? These impacts, is long lasting, how it can affect our childhood, how it can affect us even into adulthood. The impact, ACEs can contribute to toxic stress. Now there's different levels of stress. As an educator at NCC, I like a little low level of stress. If you walk into my test and you have 0 stress, you're gonna sit there, you're not gonna concentrate, nothing matters, that's low stress. I want a little stress. Little stress shows us how to be resilient. Low stress teaches us how to adapt, how to handle stress, that's okay. The problem is when we get into really high stress, and we can have high stress situations. That could be a death of a family member, right? So as a child, I may have my grandparent died. That's extremely stressful, but if I have the right support around me, that doesn't necessarily consider it's an ACE. It didn't hit our categories, right? It just means I needed that support through that. That's a high level of stress. With the right support around you, and usually we're looking at a caregiver. If we have right support, proper support from a caregiver, our stress level will come back down and we're gonna navigate that and come back out of that and okay. But what happens when we have these ACEs is we have toxic stress. So we think about this low level for my test, and then grandpa died, I'm up here, but I come back down. Toxic stress is living in the environment of constant way up here stress. That's the toxic stress of which I'm talking about. So when we have the toxic stress and it's constant, it starts to do stuff to our brain. And that's where we'll get a little sciencey as well. It impacts your ability to form healthy and stable relationships because it impacts your brain development, the neural pathways in your brain, and it leads to physical and mental health issues. So we definitely will see these impacts. When our body is stressed, we have these special places in our brain. The first place that we're gonna see it is the amygdala. Fancy weird word, right? But it's part of our system that's basically like a smoke alarm. It recognizes stress, a danger, a bear in the room, right? The fight or flight response that comes out. So when your body is in this constant, that gets that stress, gets that alert. Now, if there's a bear that comes in the room, I want you to be stressed and please remove yourself from the room, right? There's reasons for stress. So the problem is when we live in that stress, the bear is always in the room. The bear does not leave the room. So I'm living in this constant state of stress. Am I gonna get my next meal? Do I have to take care of my siblings who are, I'm 5, but I gotta take care of my 3-year-old because nobody's taking care of us, right? That's a constant state of stress. And I don't know when that bear is gonna leave, so I'm just gonna live up in here. What happens is your amygdala, your smoke alarm, it sends out this distress signal, right? So then we have these hormones that our body releases. And yes, I know I'm getting sciencey, but I think we all know them. Adrenaline, we've heard of this? Okay, so what does adrenaline do for you? Helps you fight or flight. If there's a bear, the adrenaline is your body's response that says, ooh, my heart has to beat faster so I can run. I have to breathe faster so I get more oxygen to my cells, right? My muscles need to be ready so I might get a little shaky and a little twitchy. Some of us recognize this in anxiety because anxiety does the same thing, and panic attacks, right? That's our body's way of being stuck, where our mind, our amygdala, says there is a threat. Whether there is or not, you think that there's a threat and your body responds. So that is what's going to happen with your adrenaline. So that kicks in, and then we have another one you've maybe heard of as well as cortisol. Well, cortisol keeps that running. It decides, yep, you are under stress, we're going to keep that process going. And so now we can start having negative physical effects as well because of the high doses of adrenaline and cortisol that are coursing through our blood, even as a small child, because we think there is a bear in the room, even when there's no bear. We are under that toxic stress that I'm talking about there. So let me flip to the next slide. So some physical things we will see in result to the chronic toxic stress that we can live in, especially as a child, because that's what we're talking about today, but that doesn't mean that this still can't affect you as an adult. Chronic stress can affect you as an adult. You can live with that high adrenaline, the bear's in the room, and that cortisol that says, yep, keep believing there's a bear in the room, keeps that body on alert in the same way. So some physical health things that we can experience even into adulthood would be severe obesity, diabetes, stroke, cancer, heart disease, COPD, and then also I put it under physical health, but sexually transmitted infections. We used to call them STDs. Now we've moved more towards STIs. But that is a lot of times because we're doing some really risky behaviors because of our mental health, okay? But it's a physical health problem, right? So we do recognize that this prolonged toxic stress does take a toll on the body. We can't get ourselves to come back down to our resting state. You and I are in a resting state, I hope, sitting in this room. That's fine. I don't have these spikes of adrenaline. I don't have these spikes of cortisol. But when I think there's a bear in the room because my amygdala is so used to running on that toxic stress, these are some physical things that we can see happen. But we also know that some of the mental health aspects can happen with the toxic stress. Depression, anxiety, PTSD, ADHD, drug use, alcohol use disorder, smoking, and even suicide attempts because of the toxic stress that we're seeing. Now you might wonder, why is this happening? Well, as a child, our brains are in overdrive. They are developing, they are creating new pathways, they are constantly learning new things. Our kids' brains are very pliable, they're like clay, right? We can mold it into kind of what we want it to be in the right environment. But the opposite can happen too if there's something toxic happening within that home, within that child's life. So during this period, they are very impacted by their experiences. Now, positive, loving, stable experiences obviously can do really good things for our pliable, growing brain. But, however, the toxic stress that I've talked about can actually change the physical structure of the brain and change the pathways of which our mind works, right? So, pathways, again, science, you got neurons, they talk to each other. So, we can get, our brains can get kind of pruned and we can get rid of pathways we don't use. We can also create kind of ruts where we constantly are going through the same pathway, and that's where we get into our certain mindsets, our ways of thinking, and how that impacts then some of these other things that happen in our mental health. And again, we can start to see these physical changes that are happening within the neurons, within the brain structures. If we're not using that, we're not creating and developing new pathways, or we're not using that, our brain says, oh, you're not using that, I'm going to be effective, I'm going to be very efficient, and I'm just going to not use that pathway and kind of get rid of it. So we need to make sure that we're nurturing, even at an older age, nurturing our brains and continuing to look at these neural pathways that we're talking about. So, what are things that can be impacted by these ACEs? Yes, brain structure, neural pathways, all these things, but that then means we got to think, well, what does that mean? So my neural pathways are affected, my brain structure is affected. Well, that's where you get your personality from. A lot of that is where you get your personality. So personality, that is going to be, if we want to look at the real definition, it's a collection of our typical patterns of thinking, feeling, and behaving. Well, oof. Now that means it could affect a lot of different things. My thinking, that can obviously be my mindsets, the way I perceive the world, the way I think about things, right? It can also not just affect that, but your feelings. Well, that's obvious because I can get my depression and anxiety in there, right? And then also the behaving, making some choices, maybe, that we wouldn't have normally made. So our personality starts to get impacted by the way our brain is developed in those neural pathways of which are being used. And so now we have to look at it and say, well, when a child is chronically stressed and then thinks that there's a threat, it's going to learn survival skills. Then I start realizing, the more when I reflect back on people I've known in my life, well, sure. If I, for example, couldn't trust that I was safe, if I always felt threatened, it may lead me to kind of create some habits that I might use in the world that actually in childhood may help me survive, but in adulthood look kind of toxic themselves, right? So trust is going to be built on safe, predictable type foundation. If I don't trust you as a child to bring me my food and put a roof over my head and take care of my daily needs, that trust then might later in life look like somebody who's never quite trusting in relationships, doesn't want to get close to people. They may have very deep-seated trust issues. They maybe even would look at it and try to avoid getting hurt, right? So they just want to kind of keep their distance from everybody. They never bring down their walls. They never really fully want to get close to people. And they're constantly pushing people away. That might root from mistrust. I don't trust that my needs are going to be met, so I don't want to get close to you because I'm not going to get hurt again from that, right? It also can leave a deep-seated, lasting imprint on your self-worth. So if we look at what self-worth, that is a fundamental belief that you are valuable and deserving of love and respect. If you were not treated like that as a child, it makes sense that we don't grow up with that self-worth, because what is that? It is the fundamental belief that you are valuable and deserving of love and respect. If I'm being yelled at, if I'm being hit, if I'm being abused and neglected, do I believe that I am worth love and respect? Probably not. I can see how that would impact us, right? So this is not something we're born with. We learn. This is a learned behavior. And when we're living in tragic things like these ACEs, it is a learned behavior that I'm not valuable. I'm not worthy. Right? And that's where we lose our self-worth. And so what happens is we end up making bad choices again. And that impacts us even in our adulthood. Children, if you haven't noticed, I'm sure you have, are very self-centered, right? They think the world kind of revolves around them. But you have to think about that too then and say, well, if they think something bad is happening in their home, they probably blame themselves for it. Must be my fault, right? Because they're so self-centered that they're in their developing brains, they conclude that they must be the cause. So these bad things are happening in my life because it must be because of me. And then that is going to negatively impact their self-worth. So behavior is kind of that third piece. We've talked about the different pieces of how our personality can be impacted. Behavior definitely can be impacted. It is profoundly shaped by ACEs. Again, so then we come back and we see behaviors that you and I might not like to see from each other, right? A lot of these are, again, stemming from coping mechanisms. So what I'm looking for here is, how did I learn to navigate and survive? I learned to cope in a certain way. Sometimes our coping mechanisms are not good. For example, if I feel really bad about myself and I feel like I'm not worth anything, in order to feel better, maybe I pick up that alcohol and I start drinking at a young age, because that makes me feel better, right? That makes me feel in control, that makes me feel less sad, right? And I maybe have more worth if I can drink that alcohol. So then we get ourselves in really bad habits and bad routines, and we make bad choices as children and even as adults. We do the same thing. So a lot of these coping mechanisms, they are, again, these strategies that we use to survive circumstances. But if a child, again, doesn't feel that their needs are being met, not only with the person may they push you away, but they also may become impulsive. They may maybe do the risky things, okay? And that's where we start to see some of these other things happening in our mental health. So some people will turn to drugs, calm their anxiety. Some people will do risky things, maybe not see their value, their self-worth, maybe risky behavior sexually. So there's a lot of choices that can be made rooted from the way their brain got changed, developed in pathways because of the negative impacts early in their life. So I don't want to have everybody think that everybody's getting screwed up, right? Oh, we all have these bad impacts. We're all going to be screwed up as a society. No, we're not. We can do some things to help, and we're going to talk about that in a second, but I do want to hit this home a little bit. What could prevention reduce? So if we were to know these things about ACEs, understand them, and do some prevention, which I'll get to in a second, what could we reduce? Science and statistics show us suicide attempts among high schoolers are up by 89%. So we can reduce that, bring that down if we can reduce ACEs. That's a lot of suicide attempts by high schoolers, okay? What could prevention reduce? Prescription pain medication misuse among high schoolers is up by 84%. So we're seeing these negative impacts from these ACEs. So it's not just suicide attempts, it's prescription pain medication. We have depressive persistent depressive symptoms in high schoolers by 66%. That is up. We keep going up on these things, and we need to bring these things down. We can bring these statistics down if we can help with some of the prevention. Or if we can't prevent, what can we do after? And that's where we'll get in a second too. So depression in adults by 78%. High school income levels and educational attainment in adulthood can be impacted for the better if we were to prevent some ACEs and or walk alongside people after the impacts. Okay, so there's definitely some things that we can do. So that brings me to, what are we going to do about it? Right? How are we going to prevent it? Well, I think you and I can understand if we can prevent some of the impacts, negative impacts, so abuse, neglect, divorce, incarceration, all the things that we've listed in the beginning of what are ACEs, what are these negative impacts, that can help. Can we always prevent those things? No, right? We can't always prevent them. So we can have resources in the community that might be able to help in some of that prevention. We can have a supportive mentor for a parent to learn some parenting skills. There's a lot of different things we can do to come and make sure that needs are being met emotionally, physically, mentally, all those types of things. And we're not having negative impacts on our kids. So prevention, again, protective factors. We can learn resilience. Again, some stress is okay, but if I have the right support, I can learn resilience, and then I can bring my stress level back down, right? Positive childhood experiences, those positive relationships. The number one thing that prevents ACEs is a positive relationship, a healthy relationship with a caregiver. So that's really the huge part of our prevention. But we can also do some risk assessments and screenings, one of which you have in front of you is the adult, right? So we can do risk assessments and screenings so that we as professionals, we as people, we as a society understand the impacts of these ACEs. We know the higher the number on these screenings, the more likelihood we have for negative outcomes, of which we just talked about. And then it comes down to, this is kind of where I step in, my colleagues step in, professionals step in, therapists, trauma-informed therapists are amazing and a great resource, and trying to do some therapy and some personalized care. That's really where, hey, we've had this impact, I can't help the impact that happened to this person, but what can I do now? We can come alongside them, we can help them process, we can help them get through some of the trauma that they've had in their life and be able to make new pathways of thinking. Our brain is so powerful, it will always believe what we continually tell it. So as a child, if it's told, you are worthless, you are worthless, you are worthless, it's gonna believe it. But we gotta come in, even as adults, it's never too late. We gotta come in as adults and shift that thinking. We gotta change the way we're thinking. We start telling our brain the positive things. You are worthy, right? You keep telling that every day, your brain will start to believe it. That's a new pathway you can create at whatever age, right? So the important message here today, hopefully you're picking up on, is hope. It's not hopeless, right? There's things we can do even into adulthood that can come and we can kind of peel back the layers of the trauma that we maybe experienced. I really, the word trauma-informed is a little confusing to people. They don't know what that means. That just means my approach to you is going to come from this place of knowing that there's been that trauma in your life. But I will promote, even though it's not me, I will promote trauma therapists. I really think that they are part of the huge piece of the puzzle that are really going to bring this down. You notice I haven't mentioned meds? That's half of what I do, right? Because meds don't solve these problems all the way. Meds can help you give a better place of which to work from, a better foundation, but that doesn't help the fact that we need to create the new pathways, the new ways of thinking, and that's what's going to come through with therapy. So I hope you come a little bit away from this with a little bit of hope, right? The past can shape us, but it does not need to define us, right? We can still understand that our brain is plastic. It can change. It can, even in adulthood, right? It can create new pathways, new ways of thinking, new outlooks on things. New perspective is what is going to create those new neural pathways. So this means that we can learn new ways of thinking, feeling, and behaving. Those things that were negatively impacted by those ACEs that we've been discussing. So I also think it's important to recognize good rest, good exercise, establishing a routine. Those can all also help create a sense of safety. So if you come from a place of trauma, usually that means you felt unsafe for some reason. Coming up with some of those routines, structure, that can create a sense of security and safety in us as well, and those can really help our nervous system that's trying to say there's a bear in the room, calm down. There's coping skills we can use to do that. I teach a lot of kids what I call box breathing. When you feel like this, that's your adrenaline, because your amygdala said there's a bear in the room, right? So you're feeling a little shaky, you're feeling anxious, you're feeling like your heart's beating fast, whatever that might look like for you, even if it's low level. Box breathing is something I teach the kids at the school. I go there once a day a week. And we make a box, okay? So we breathe in slowly for 3 to 4 seconds, and then we hold it for 3 to 4 seconds, and then we breathe out through our mouth slowly for 3 to 4 seconds, and we hold it again. We make our box. So the in is slow, the out is slow. Don't forget that, because kids want to go, no. That's not going to help you. In fact, if anything, it's probably going to make you hyperventilate and make you more anxious. So calm it down, slow it down. Great tools. Journaling can be ways of getting some things out. Gratitude journals, I've heard of those. Recreating new pathways of thinking, new ways of thinking. Our brain will, again, it will believe what we tell it. So if we try to focus on the good. So a lot of these tactics you can do even if you're not comfortable going to a therapist. We can start to make some shifts and changes even at whatever age it might be. So any questions that I can answer for you? If you're curious about my references, there they are. Otherwise, questions? Did any of this surprise you? I don't know. It's okay if you're surprised. I think we have not done a great job in society about talking about mental health. And I really think, especially the older generations, of which I will throw myself in, because I know being raised, I'm almost 50, and I know being raised, we didn't talk about mental health. It was one of those things, well, what's wrong with them? They just get up off the couch, pull themselves up by their bootstraps and get out to work, take care of their kids, whatever that might look like. Suicide to me was always described as a selfish act, right? It was selfish. We're going to talk about it in a negative way. We never talked about it in the way of that person hurting and feeling like they are a burden, and maybe it was a relief to their family if they would, went down the suicide road, right? So there's a lot of different ways that I grew up thinking. I grew up in that culture of thinking, and I hope we're getting a little bit better about understanding mental health. But my hope is that you understand that actually science is showing us those pathways, our brain structure, things are changing in our brain because of the traumas and the adverse things that we can experience, even as adults. But there's hope because we can retrain our brains and create new neural pathways. Yeah?
I'm a suicide survivor.
You are a suicide survivor. Good for you. Yes.
I know what you're talking about.
Yes. Yeah. Thank you for sharing that. That's big. Yeah. Yes.
You said you went to school to do it, and which grades? Do you go all the way from the small to the high school, or just the middle school? Or?
Yeah, great question. So the question is, I go to the school. Yes, I do. I actually start the elementary. The youngest patients I have are 5. And we do a lot of play therapy. You'll be shocked what kids will show you with dolls. Things that they've gone through, or how things are run at their home, or things that they're struggling with. And then, so this past school year, I was there in the elementary a half a day a week, and at the middle school and high school a full day a week here in town at the public school. The wonderful thing is that's been offered through a grant through Blue Cross Blue Shield, Wellmark, and our clinic, this facility, and that means that I can see these students for free, and it's easy because they can just come down out of class for 30 minutes and then come back and go back to class. So a parent doesn't need to pick them up, take time off work, drive them to the clinic, anything like that. So I do work all the way through high school. With my degree, I can actually work birth. I don't know what I would do with a 2-day-old baby, but I could do birth all the way through the adulthood. Yes, so I do get to experience that. And actually, some of my favorite people are teenagers, although most people do not like them. I love them. But they're going through some really hard things. Yeah.
Do you find that males have a harder time reaching out for help than females? And we still have the stigma, big boys don't cry.
Yeah, absolutely. So the question was, if you're following online and or couldn't hear it, is do I feel that males have a harder time reaching out because of the stigma? big boys don't cry, you gotta be a man, that kind of thing. Absolutely. It is not uncommon for me to see people in their 70s and 80s for the very first time that they saw somebody, but that's because they didn't dare. Most of the time it's they didn't dare be honest about the struggles that they're going through. Now, I did say earlier females are typically is more of a risk factor for the ACEs, but that doesn't mean that males cannot experience mental health issues, right? Do males have brains? Yes. Can they have chemical imbalances? Yes. Right? Can they have traumas in their life? Yes. Can they struggle with really hard things? Yes. And I will argue, especially at the older ages, there's a lot of loss. It's really hard. And I can't speak completely to that, but you can lose a spouse, you can lose family, you can lose independence, you're putting nursing homes, they take away your car keys, all of that. That is horrible after all these years of being independent, being the tough guy, particularly. Even for women, we struggle with this, but that can be really, really hard for people. And you're expected in our society, men report to me frequently, I'm expected to be tough and provide for my family, and that's all they want from me. But that's really sad because we're not understanding that yes, men too can struggle, men too can have traumas, men too have brains that can have chemical imbalances that might need those meds, right? Or have pathways that were created because of their experiences. And even, I'm going to take this out of the ACEs, I know that was our talk today, but even in adulthood we can go through some really, really hard things. And even in adulthood, those can create those negative thinking in those pathways that can happen. So yes, thank you for the question. I would love to get rid of the stigma, but welcome to our society. When I taught, I'll tell you a little quick story if you have time. When I taught, I would kind of trick the students. Because I would say, okay, so we have a single mom with 3 kids who has breast cancer. What are some things we think about her, right? And they'd be like, oh, wow, she's brave and a warrior and trying so hard and all these kind of things. Okay, yeah. What are things we do for her? Well, we start the church prayer chain, we bring her cookies, we take care of her kids, we do her lawn, remove the leaves in the fall, whatever that might look like, right? Okay. Now, let's say she's not a mom with breast cancer, but she is a single mom with 3 kids that has depression and cannot get herself off the couch. And then they'd all look at me like, oof. I'm like, yeah. Be honest, what are some words we think? And our society is like weak, those negative words, right? She needs to do better. She needs, all these kind of things. I go, great, now what do we do for her? There's no church prayer chain. There's no child care. There's no leaf removal. There's no casseroles. Right? And so we do treat the mental health so much differently than we do our physical health. And that's really sad, because if you're having chest pain, what would you do? You go to the ER. Your heart can get sick and you're okay with that. But our brain is this extremely powerful organ that we seem to forget that it can too get sick. And this organ, not only does it move my body, help me feel when you touch me, right? But it also controls my personality, which we talked about, right? So my mindset, my self-worth, my behaviors, all of that is controlled up in here. So when that gets sick, why is it hard for our society to look at it as an organ in our body that can get sick just like every other organ? Cancer, diabetes, hypertension, whatever it may be. We believe in that, but we don't want this thing to get sick, right? Unless it's a stroke, then we believe in that. Right? Then that can happen, but we don't want it to get sick with mental health. And we're forgetting this huge part of who we are. Who we are as a person is our personality, right? That is what makes us us. Great question, thank you. You can see that's my soapbox. It's my passion. This is why I got into this job. This is why I want to change and bring down that stigma and change things.
I'm hearing throughout that training the brain is an excellent tool. I'm wondering if there are places, some of your classes with students, as an example, like you need more to do, right? But other things where we teach children, grown adults. I work with affirmations for myself every single day until I go off the path, wonder why I'm depressed, and then I go, oh, you haven't been talking positively to yourself, you haven't been speaking kindly to yourself, etc. So do you see where I'm going with this?
Yes, I definitely see where you're going. I wish I knew you had the mic, because that was perfect. Yes, So there are things we can do, and yes, training the brain is so important, right? So whether it is, and honestly, now in a day and age of YouTube and phones and all these things, there are apps that you can do, self-affirmation apps. I actually have students that self-harm, and it might seem like a crazy thing to you, but what they do is they'll pull their hair, whatever it is to hurt their body, to get them out of their brain, which is traumatic and scary right now. So I'll do this thing to my physical body, and it will remind me, whoop, pull me out of my brain and put me back to my body. Well, I have students that use apps to just literally count how many days since they've self-harmed. It can be a great tool. So then it's like you kind of like a patient that's in, or a person that's in AA, right? 1 day counts, 2 days count. You just keep counting those days. They'll use those types of apps even for self-harm. So there's a lot of great apps out there. There's self-affirmation, positive affirmation apps. There's meditation apps that can calm your mind and calm your body. Maybe you'll see some breathing techniques in there, right? There's a lot of things you can do. You don't always have to go to that therapist. I do think that there are people who do need to, but yeah, there are a lot of things that we can do to just continue to work on ourselves. And I love what you said, that when you get off track and go, why am I feeling more depressed? Oops, I forgot to talk nicely to myself, right? Huge point, huge point. Our brain believes what it hears, right? Whether it's as a small child or even as an adult, if you are told you are worthless and you are not worthy, you start to believe that. And that's where that depression really can kick in. So that's where, even though this may have seemed like a talk about kids, it's really not, right? And there's a lot of different aspects we can pull from today. Thank you for sharing that.
Do you have ways or things you could share with us of, if you're not maybe a direct child caregiver, but maybe are a youth group leader once a week or whatever, like what are some signs?
Some
To
signs
look
or
for
how do we
where
come
you can
along?
see,
Okay.
this child maybe falls into that ACEs.
Yeah. Well, first of all, I think we got to be aware of the question. Sorry. The question was, how do we pick up on the fact that a child could fall into a lot of categories of the ACEs? Maybe you're not the direct caregiver, but you are somebody that's in their life through maybe youth group or something like that. First of all, we have to be aware of what ACEs are, right? We have to look at those impacts that I had on the screen earlier and go, oh, okay, well, I didn't realize that could be an ACE, and I didn't realize that could be an ACE. Not that I want you to go around and be like skeptical and counting every kid, right, and figuring it out, but to kind of be aware of it at first is helpful, because then you understand that where the impacts might be. The other thing to see is, again, those signs and symptoms are going to, sometimes kids are so great at pretending everything is fine. Yep, I'm great, I'm great, I'm great. No, you're not. But usually adults who know them well can see through and crack that a little bit and see, you're saying you're fine, you're not. Usually, if that's the case, that's usually a little bit of a red flag when they're trying to pretend everything is fine when they're not, right? If they come, of course, if you're looking for physical abuse, you're looking for any outward physical signs of things like that. But a lot of this is just mental impacts that we're seeing. Physical abuse does mentally impact us, you're right, but we can't see it on the outside. Building a trusting relationship, though, where they can start to open up a little bit more is where you're going to really find it. I have kids that come to see me at the clinic, and they will take them 3 or 4 times before they'll tell me much of anything good. Because they don't know me, they don't trust me, I'm going to pretend I'm fine, right? So it can be a little difficult to really pick up on those cues. But the important thing, too, is to remember, yes, the #1 thing to prevent negative outcomes from ACEs is a trusting, healthy relationship with a caregiver. But that doesn't mean you as a person can't come along with that caregiver to help them be healthier and more stable for their child. And it doesn't mean that you, even though not a caregiver, can't be a good impact in their life. And people need to feel secure to turn off the amygdala to say there's no bear in the room. So it is a little hard to pick up on the cues if they don't want to share them with you, but to be aware of them and kind of watch for them and watch for the signals. Drug abuse, risky behaviors, those types of things, you're going to notice those maybe a little bit more. Depression is pretty easy for some kids, not all kids, to hide, as is anxiety. Anxiety, though, can show up physically, so you might see it. A little bit of shaky or super fidgety, that could be an indication. Any other questions? Well, thank you for making my first lunch and learn. A good memory for me, and thanks for sharing with me, I really do appreciate it.